Hi guys, welcome back to Tumor Talk, where we talk about neurofibromatosis. Neurofibromatosis is a genetic disorder where tumors grow on all nerves throughout the body. I have a special guest with me today. Her name is Laura Barbieri, and she has NF2. I know I should not be excited that I have a fellow NF2er here, but I am. Tell me about yourself. Tell me kind of about your diagnosis and.
Yeah, so I am a former classical musician, so that's kind of it's a kind of a big part of the story with NF.
What did you play?
I was clarinetist. One thing led to another, and I am now working special events.
How did you get diagnosed?
I started losing my hearing. So I just noticed one day I had the flu, and the flu was clearing up, but my ear felt really blocked up, and so I thought it was kind of weird, and it just got really stuffy, and it just wasn't going away after several weeks. And so I actually saw a bunch of doctors and saw a bunch of ear, nose, and throat doctors, and they all just kind of called it sudden hearing loss and sort of mentioned off the cuff that there is this one other thing that it could possibly be, but we really don't think that's it because you're not having any other symptoms. Rare. And I also didn't have insurance at the time, so it was going to require an MRI, and I was like, nah, it's fine. I'm sure it's not that. But anyway, after 2 years, I was I just noticed that progressively it was getting worse and worse, and so that's kind of how I got diagnosed.
So you went in for the MRI.
Mm-hmm. Yeah. Well, so actually when I went for my first MRI, they only found one acoustic neuroma. So they didn't.
Same here.
Yeah, really? Mm-hmm. So, okay. So they found the one acoustic neuroma, which was pretty crushing. I don't know.
Pretty shocking. It's shocking. One tumor is enough.
It scared the crap out of me when they told me I had a brain tumor. So I was kind of that was enough. And I just immediately I was all right, let's get this done. Let's get it out. Let's get it taken care of and move on. And so had that done. And then when I went back for my first follow-up 6 months after I had it out, they were okay, well, we think it looks fine on that side, but we have this one other thing that we need to talk about now. And they found this teeny tiny little spot on the other side. And the crazy thing is that actually when I had my first acoustic neuroma, I was consulting with every surgeon on the face of the planet because of course I was
how do you pick?
Yeah,
what did you do to really pick?
I mean, I called dozens of surgeons, and I was living in Houston at the time, and so I was my family's from New York, so I was coming back to New York to meet with different surgeons, and I wanted to know everything about what technique they were going to use and if they thought that they could restore any hearing or save any hearing. So actually when I was a baby, I had a neurofibroma removed from my neck when I was 2 years old. And so there was kind of that instance where it's okay, I had a neurofibroma before in my life. So is this, could the two at all be related? Is there a possibility it could be NF2?
Was it inside your neck or on your neck?
It was on a nerve in my neck.
Okay, so it was in your neck.
Mm-hmm, yeah. And so all of the doctors that I was seeing, almost all of them were no, there's no way it's NF2. It's just, you're clear on the other side, you're older, this gets diagnosed with most people when they're young, except for one, and it was the folks at NYU actually, which is, where the clinic is. And so, of course, when I went to NYU, they were we're not doing radiation surgery, you almost definitely have NF2. And I was just what? And actually I decided not to use them just because I was no, they don't know what they're talking about. I'm not even touching that, I wouldn't even go near it with a 10-foot pole. And so, but they were the only ones that called it early on, before I was even diagnosed. They were it's almost definitely this.
It's kind of weird, I feel it's weird when you get diagnosed. So I got diagnosed at someone playing Charlotte. It's kind of the same way. I was no. I don't want to be near them, because they were you're going to lose your hearing by the time you graduate high school. And I was you don't know what you're talking about.
So wait, how old were you when you got diagnosed?
So I was 16.
Okay.
So I was 16, I got hit in the head with a volleyball.
Okay.
And I went in and they were so they said you have one tumor. And I was oh, okay, 16.
So did you notice anything wrong after you got hit in the head?
Nothing was wrong.
So you just went in for a normal routine. Did you get an MRI?
Yeah, I just got it. They were you have a concussion. We probably should do an MRI just in case. Yeah. They were we have to sit you down. You're gonna go deaf. And I was what? Because they were pretty. My tumors are
That's about mine too. Mine's 2. Yeah. The one that I have now is 2.5 centimeters, I think.
The one so you got one removed.
Yeah. Mm-hmm.
And what was going into brain surgery? Wait, how old were you, if you mind asking?
Yeah, so I was like a lot older when I got
Okay.
diagnosed. I was 30 when I got diagnosed.